Who decides what is included in Medicare coverage? In recent news, many people are asking an important question. Who decides what is included in Medicare coverage? This topic is trending as more individuals seek clarity on their health care options. Understanding how coverage decisions are made can help you navigate your benefits more effectively. Medicare coverage decisions are primarily made by the federal government through the Centers for Medicare and Medicaid Services. This agency administers the Medicare program and establishes what services, treatments, and items will be covered. The decisions are based on medical necessity, clinical evidence, and cost-effectiveness. The Centers for Medicare and Medicaid Services sets both national and local coverage determinations. These determinations define which services are eligible for reimbursement under Medicare. For example, if a new treatment is developed, it must be evaluated for its effectiveness before being included in coverage. In addition to the Centers for Medicare and Medicaid Services, the Medicare Payment Advisory Commission plays a role in this process. This commission provides recommendations to Congress about Medicare coverage and payment policies. Their input can influence what is ultimately included in Medicare. Recently, the Centers for Medicare and Medicaid Services has contracted with private companies to assist with coverage decisions. This is particularly relevant under new models like the wasteful and inappropriate service reduction model. This model aims to reduce unnecessary spending by reviewing the medical necessity of services. These private companies utilize advanced technologies, including artificial intelligence, to analyze data. However, all final coverage decisions are validated by clinicians to ensure appropriate care is provided to beneficiaries. For those enrolled in Medicare Advantage plans, private insurers approved by the Centers for Medicare and Medicaid Services decide on specific benefits. These plans must cover all services that original Medicare covers but may offer additional benefits. The Centers for Medicare and Medicaid Services oversees these plans to ensure compliance and accuracy. Employers and group health plans also interact with Medicare coverage rules, especially regarding coordination of benefits. However, they do not decide what Medicare covers. Instead, Medicare rules determine when it is the primary payer versus when employer plans pay first. In summary, Medicare coverage is determined by the Centers for Medicare and Medicaid Services based on clinical evidence and policy goals. This process is supported by expert review and oversight, ensuring that beneficiaries receive the care they need.